Welcome to Quick Medical Review. Today's Cerebral Vasculature and Neurologic Organization in under 5 minutes. Let's go. Buzzwords first. MC, a face and arm weakness. Broca and Wernicke aphasia. AC, a leg weakness contralateral. PC, a homonymous hemianopia visual cortex. Circle of Willis connects anterior and posterior circulation. Watershed zones between vascular territories vulnerable to hypotension. Let's break it down. The brain is supplied by the internal carotid arteries anterior circulation and the vertebrobasilar system posterior circulation. They connect via the circle of Willis. Middle cerebral artery MCA, the most commonly affected in stroke, supplies the lateral cerebral cortex. Occlusion causes contralateral face and arm weakness, arm greater than leg, contralateral sensory loss. Dominant hemisphere, usually left, Broca aphasia, frontal expressive, the patient knows what they want to say but cannot produce fluent speech. Wernicke aphasia, temporal receptive, fluent but nonsensical speech, the patient cannot understand. Non-dominant hemisphere neglect, the patient ignores the contralateral side. Anterior cerebral artery, ACA, supplies the medial frontal and parietal cortex. Occlusion causes contralateral leg weakness and sensory loss, leg greater than arm, the opposite pattern of MCA. Personality changes, frontal lobe. Urinary incontinence. Posterior cerebral artery PCA supplies the occipital lobe and medial temporal lobe. Occlusion causes contralateral homonymous hemianopia, loss of the same visual field in both eyes. Memory problems, hippocampus. Vertebrobasilar system supplies the brainstem and cerebellum. Basilar artery occlusion, locked-in syndrome, the patient is aware but can only move eyes vertically. Cerebellar stroke, vertigo, ataxia, nystagmus, dysarthria. Pica posterior inferior cerebellar artery occlusion causes lateral medullary syndrome. Wallenberg syndrome, ipsilateral facial sensory loss. Horner syndrome, cerebellar ataxia, contralateral body pain and temperature loss. Dysphagia, hoarseness. Circle of Willis, anterior communicating artery, connects the two AC as the most common site of berryaneurysm. Posterior communicating artery connects the ICA to the PCA cranial nerve, 3 palsy from aneurysm compression. Watershed zones, border zones between two major arterial territories, vulnerable to global hypoperfusion, cardiac arrest, severe hypotension. Causes man in a barrel syndrome, bilateral arm weakness with preserved leg and face function. Upper versus lower motor neurons, UMN, cortex to spinal cord spasticity, hyperreflexia, Babinski positive, no atrophy. LMN, spinal cord to muscle flaccidity, hyporeflexia, fasciculations, atrophy. Exam Pearl MCA equals face and arm greater than leg aphasia if dominant hemisphere. ACA equals leg greater than arm. PCA equals homonymous hemianopia. Pica equals Wallenberg lateral medullary syndrome. Anterior communicating artery, most common aneurysm site. UMN spastic, hyperreflexic, LMN flaccid, atrophy. That was Cerebral Vasculature and Neurologic Organization on Quick Medical Review. Study smart, not hard.